All right, class, this is the wrist and hand lecture. A brief overview over the contents discussed in the elbow and proximal forearm lectures. Remember, the elbow joint is comprised of the articulations between three main bones. And these three bones are the distal aspect of the humerus, the proximal ulnar, and the proximal radius. Now, about the elbow joint proper, we have our flexion and extension motions. This mainly occurs with the articulation between the distal humerus and the proximal ulnar. This occurs at the ulnar humeral joint. More laterally, you see that we have this radial humeral articulation. It's a very superficial, essentially goes along with the ride as far as elbow flexion is concerned. It also goes along for the ride as far as pronation and supination is concerned. Forearm supination and pronation, the main joint site is the radial ulnar joint. This is the articulation between the proximal radial head and the proximal ulnar. So remember, as we engage in forearm pronation and supination, the radius rotates about the ulnar. For our ligaments, we have our ulnar collateral, our radial collateral ligaments on the medial and lateral epicondyles and inserting on either the ulnar or the radius. We also have our annular ligament. Remember that the annular ligament wraps around the proximal radial head and secures that head in place as we engage in our elbow movements, more specifically the forearm supination and pronation actions. Another structure that helps stabilize these bones as we engage in forearm supination and pronation is this structure here that spans the shafts of our ulnar and our radial bones. This is the interosseous membrane. So along with that annular ligament, we also have this interosseous membrane that essentially holds these bones together as we engage in our forearm pronation and supination action. It's also important to consider the bony characteristics of the ulnar and the radial bone, especially as we travel from an area that's more proximal to an area that is more distal. You notice on the ulnar bone, the bony architecture of the ulnar bone is longer on the proximal attachment. And as we move down here to a more distal region, this is where the articulation of our wrist takes place. We notice that in this case, the radial bone on the distal side is larger than the ulnar. Again, this will help us orient ourselves as we begin to discuss the characteristics of the wrist. All right, moving on to characteristics of the wrist. We have a total of 8 carpal bones. These carpal bones are the bones that make up the actual wrist. They are divided into a proximal and a distal row. After that, we have 5 metatarsals. As far as numbering our various fingers, we start from the thumb and move all the way to the pinky. So digit 1 will be our thumb, digit 2 will be our pointer finger, digit 3 will be our middle finger, so on and so forth. So along with those 5 metacarpal bones, we have a total of 14 phalanges. So from digits 2 through 5, these phalanges are divided into 3 separate bones. We have a proximal, middle, and distal phalange. You notice here for the thumb, we only have 2 phalange bones. Each of these bony sites have a corresponding joint that articulates each of these bones together, various joints. So starting off here with the articulation between the radius and the proximal row of our carpal bones, this would be our radial carpal joint. This articulation is very similar to what we see in the elbow, in that about the wrist, the main articulation occurs within the radial bone. Again, here about the wrist, we are dealing with a condyloid joint. So with a condyloid joint, you'll have some sort of convex structure articulating with a concave structure. So with the concave structure, you notice that we have the vast majority of our distal radius, as well as the smaller aspect of our ulnar bone. And then we have the convex nature of our proximal carpal bones. Again, the radiocarpal joint, the main articulation occurs between the radius bone and the proximal row of our carpals. All right, we also have our midcarpal joints. This is between the proximal and distal carpal rows. We have our intercarpal joints, which are just the joints in between the carpals in the same row. And then we have our carpal metacarpal joints, our CMC joints, and this will be between the distal row of our carpals and the metacarpal bones. Moving on to the nomenclature of our carpal bones, you notice here that, again, we can orient ourselves as far as which side of the hand that we are referring to, just based on looking at the radius and ulnar bone. I know that I'm looking at the distal aspect of these two bones, and having the knowledge that the radius bone is more larger in comparison to the ulnar bone, I notice that this is my radius side, and I know that this will be my thumb. All right, starting off on our thumb side, we'll have our scaphoid, we have our lunate, we have our tricutrem, and we have our pesiform. You notice that the pesiform is essentially just a protrusion of the tricutrem bone on the proximal row here. After that, our distal row will consist of the trapezium bone, the trapezoid, the capitate, and the hamate. As far as the joints are concerned, this will be our radiocarpal joint site, and this will be our CMC joint site, our carpal metacarpal joint site. Here are some mnemonics that may be useful to help you all remember each of the carpal bones specifically. For example, for this one here, starting off again on the thumb side, so long to pinky, here comes the thumb. Here's like another funny one. Try to catch her. She looks too pretty. It's a little stalkerish, but hey, I don't make these up. I just give you guys information. Moving on to the ligaments of the wrist, we have our capsular ligament, and this will mainly just be our radiocarpal ligaments. You notice that we have them on both the volar or palmar side, as well as the dorsal side as well. After that, we have our radial and ulnar collateral ligaments. Again, this is analogous to what we see about the elbow joint, in which we have the ligaments on the medial and lateral side of our wrist. And then another important thing here to consider specifically is what we call our retinaculum. Another word that you'll see here is the transverse carpal ligament. And it's located not only on the anterior side, we also have it on the posterior side as well. So on the anterior side, this transverse carpal ligament will be referred to as the flexor retinaculum, and on the posterior side, it will be referred to as the extensor retinaculum. This is a very important structure in which all of the muscles that act to move the wrist will pass underneath these structures at its various locations. Here is a table that explains the ligament as well as its overall functioning. This is hip pocket information, and it essentially makes sense as far as which ligament limits which specific function. You know, like a prime example here, the radiocarpal ligament on the posterior side will limit flexion of the wrist, right? As you flex your wrist, this posterior radiocarpal ligament becomes taut, essentially limiting its range of motion, right? You'll see this same pattern essentially all the way down here. It just depends on where the ligament is located. Again, you see we have our transverse carpal ligament, also known as our flexor or the extensor retinaculum. This will be essentially the roof of our carpal tunnel. I will discuss the carpal tunnel later on here in the lecture. Going on to the joints of the hand, after our CMC joint, we have our metacarpal phalangeal joint. After our MCP joints, again, we hit our phalangeal region. Remember, digits 2 through 5 will have a total of 3 phalangeal joints, and they are divided by either the proximal interphalangeal joint or the distal interphalangeal joint. Now for digit 1, which is our thumb, remember that we only have 2 phalange bones for the thumb, and that will be articulated by just 1 interphalangeal joint. Our movements of the wrist that we will consider, we have flexion and extension. It's occurring on the sagittal plane. We also have radial and ulnar deviation, also known as wrist abduction and wrist adduction. Here, this image is depicting the movements of the hand. Again, as far as the hand movements are concerned, we're able to abduct and adduct our hands, flex and extend, especially from digits 2 through 5. The thumb is a little different. While we're referring to the thumb, we also have the saddle joint. So not only are we able to flex and extend about the thumb, abduct and adduct, we are also able to engage in what we call opposition and reposition. And this occurs only at the thumb. Here's another table that is illustrating the range of motion as far as wrist flexion and extension is concerned. If we hold our hands out in anatomical position, you notice that we have slightly more range of motion as far as wrist flexion is concerned, as opposed to our extension actions.